and the plasma osmotic pressure. In the given figure, we can see that in the artery, the hydrostatic pressure is more and the colloidal osmotic pressure is less, due to which the fluid goes out to the out from the vessels. But in the vein, the hydrostatic pressure is less and the colloidal osmotic pressure is high, due to which the fluid from the interstitial space come into the veins, and from the some 10% of the fluid goes into the lymphatics, which further drain into the veins. Hydrostatic pressure is here it is written that hydrostatic pressure is more at the atrial end, whereas osmotic pressure is more at the venous end. Small residual amount of excess interstitial fluid is also drained into lymphatics. So what is edema? Edema is abnormal or excessive fluid in the interstitial space located beneath the skin and in the cavities of the fluid. Here in the picture we can see that this is a normal foot and that the foot with the edematic foot due to the accumulation of fluid in the interstitial space. Edema is a normal response of the body to the inflammation or injury. For example, twisted ankle, bee sting or an unsting infection will all result in the edema involved in that area. In some cases such as an infection, when the monocytes and some proteins also leak to the interstitial spaces, this triggers the immune response of the body and responsible for the immune response in the body. Now there are many causes which responsible for the formation of the edema. That are the increased hydrostatic pressure, reduced plasma oncotic pressure. 3 is the increased blood vessel, means the permeability of capillaries increased, obstruction in the lymphatics and the water retention. Now first of all, we see that the increased capillary hydrostatic pressure. If rise in the hydrostatic pressure at the venular end of the capillaries to a level more than the plasma oncotic pressure, then this leads to the excessive filtration of fluid from the capillary into the interstitial spaces, which causes the edema. Second point is the reduced plasma oncotic pressure. Due to the reduced albumin synthesis in the liver, this causes the hypoproteinemia. Since we know that the albumin is mainly responsible for the colloidal osmotic pressure in the blood vessels, so proteinemia means hypoalbuminemia in case of the colloidal osmotic pressure. Due to which due to hypoalbuminemia, fall in plasma oncotic pressure lead to the net movement of fluid into the interstitial space, which causes the edema in our body. Third is the inflammation. In the blood vessel, due to the increased permeability of the blood vessels, monocyte squeezes out from the blood vessels, and some more fluid and the antimicrobial chemicals also leak down. Here in the picture we can see that the normal permeability of the capillary in which and this is the increased permeability of the capillary in which the antimicrobial chemicals and the monocytes leak out of the blood vessel and causes immune response of the body. Lymphatic obstruction. This type of obstruction leads to the localized edema, in which, for example, the elephantiasis and the radial mastectomy of the breast cancer. Fifth and the last point is the sodium and water retention. Due to the low volume of fluid in the blood vessels, this is called the hypovolemia, and it is maintained by the three factors, that is the extrarenal hormonal mechanism, intrinsic renal mechanism, and ADH mechanism. Due to the hypovolemia, baroreceptor activate and it send the signals to the vasomotor center, and from the vasomotor center the sympathetic outflow come to the blood vessel and cause the renal ischemia, in which the GFR is decreased and the excretion of sodium is low, due to which the sodium and water retention occur. Since the renal ischemia occurred and this caused the low level of sodium ion into the renal tubules, which causes activation of JG cells. Due to the activation of JG cells, it releases renin. As we know, the angiotensin present in the plasma, renin converts the angiotensin into the angiotensin 1, and the angiotensin converting enzyme convert the angiotensin 1 into the angiotensin 2, which causes aldosterone synthesis from the adrenal medulla and also causes the vasoconstriction in the body and causes sodium and water retention from the renal tubule. And the last is the ADH mechanism. In the ADH mechanism, due to the hypovolemia, posterior pituitary activate and release the ADH hormone, which causes the water retention from the renal tubule and causes increase in the blood pressure and overall causes the edema in our body.